Really disturbing story coming out of Massachusetts. After a coronavirus outbreak occurred at an elderly veterans care center, an investigation in Massachusetts found that the leadership there failed miserably, that there were substantial errors made in preparing for the coronavirus crisis and responding to it. And the result was numerous deaths. The report found that the superintendent at Holyoke Soldiers Home was, quote, not qualified to manage a long-term care facility, and his shortcomings were well known to the Department of Veterans Services. That's before the coronavirus. So with us now, with a little more perspective on this, is Cheryl Fiandaca with our Massachusetts station WBZ. Hope I said your name properly, Cheryl. So Cheryl, the reporting says that problems really began to happen when, for whatever reason, the facility chose to take its two wards of patients suffering from dementia and put them together, creating one ward. Why did they do that, and why did that become so problematic as the coronavirus began to spread?
Well, two reasons. One was they did it because they were short-staffed. Basically, they had a lot of sick calls that day, and they thought they should combine these units. The problem with doing that, obviously, was that they had some patients, some residents who were positive for the coronavirus, some who were negative, and some who were not tested. So once you put them all together in one unit, you had the perfect storm, and the results were catastrophic.
So Governor Baker called the details of the report, quote, gut-wrenching. You've read the report, so what details stand out to you?
Oh my goodness, it is gut-wrenching. It really, really is. It's horrific. I mean, the details are like something you would maybe read about a concentration camp. They brought all of these men into a dining hall where they basically stacked them up. Some were wearing clothing, some were partially clothed, some were dehydrated, some were obviously very ill and in various stages of dying. It was just a horrific situation that just escalated to the point where now they have more than 76 deaths at that home. And this is a state-run facility, so it's just so tragic.
So the situation with this facility is, even before the coronavirus, it wasn't being managed very well. Then you introduce the coronavirus, and we've seen, all across this country where there are issues with healthcare, the coronavirus has just exacerbated them. But then there's this business of covering everything up afterwards. So I want to play a little bit of Governor Baker's press conference yesterday where he talks about the cover-up. Let's play that sound.
It's pretty clear based on the report, which is incredibly detailed and overwhelming in some respects, that errors in judgment were made before the pandemic began, in anticipation of the pandemic, and once the pandemic landed. And in addition to that, represented in a number of instances a misrepresentation of what was actually going on in the home and its communications to upper entities of the administration. So clearly, there were issues there with the leadership team.
All right, so can we talk a little bit about the leadership that apparently now, according to this report, was really not qualified to run a facility like this? And then what happened afterwards? Tell us about the cover-up. What do we know?
Well, there are two things. One is the person that was running the facility, Bennett Walsh, did not have any healthcare experience. And basically, this is a long-term care facility. They call it Soldiers Homes. You can call it, a facility for veterans, but it's basically a long-term care facility. Most of the veterans there have underlying health conditions. In 2016, the legislature had put something together where basically they said that we need oversight of that home. And what that means is we need a position that oversees two soldiers' homes, and that person has to have medical experience. That position was never filled, even though the money was appropriated for it. So that was one failure. And the other failure they're talking about is that when all of these things were starting to go wrong, there's some concern as to whether or not the management team actually notified Veterans Affairs. Veterans Affairs says in this report that they were not notified until it became a catastrophic situation. But Bennett Walsh, through his attorney, has said that he did notify them and they were aware of the problems. So this will all play out in court because his position is now being challenged in court.
Cheryl, it just breaks my heart, this report and the findings, because it's not, people may think that this is new. This has been the case for years, going back many, many years. that this country does not treat its veterans in the way that they should. And Governor Baker has announced that, said that he will be announcing reforms already today. Are you aware of what some of those might be? And what are the conditions at Holyoke like now?
Well, it is awful. I mean, as you said, it's just heartbreaking to see that all these folks who, served this country were treated like this at the end of their lives. It's awful. Some of the reforms obviously would include training for the staff and a permanent staffing situation, which they do not have. Better record keeping, better supplies, better infection control. All of those things are all being discussed. But you also need a management team that has healthcare experience, because this basically is a healthcare facility, a long-term care facility. So all of that definitely needs to be addressed. And going forward, what's the home like right now? Well, the home right now, they don't have any positive cases there. They have resumed visits with families. The staff is being trained. And the families that we've talked to whose loved ones have died, they found this whole thing is just horrific. And they want a new facility built in the memory and to honor all of these veterans who died, which should have been done many, many years ago. So that's what they want going forward, is something to honor all of these men who served this country and died in a very, very terrible way.
Indeed. This is really, really important work that you've done here, Cheryl. Thank you so much.